finally you get tied with the service that you want to provide. That's how missionaries come with healthcare first, because you win over people when you do that. And if you provide some healthcare anywhere, you win over people, because it's a quickest way to reach out to people's respect and admiration. So this provides the kind of a background to that. And when something is admired, it's also a field for exploitation. You use that admiration for some other motives. And in the case of healthcare, it may be money making, very simply. Profit maximization behind it. So healthcare gets derailed because of the money-making approach. So I wouldn't say wholesale that all money-making healthcare is wrong. Get rid of it. I'm saying this is a tremendous opportunity for money-making in the name of healthcare. We tried in a small way, in a desperate way though, when the corona epidemic was going on. And we were talking about vaccine development at that time. Before the vaccine came, our campaign became one single issue that whenever that vaccine comes, it has to be made patent-free. And in the beginning, everyone said, why? You have to make it patent-free. It's impossible to do that. And I kept raising the issue of polio vaccine. It was made patent-free. So this is not something that you're doing for the first time. You're only repeating what has been done. People had 101 excuses for not going to that route. But we started campaigning. Many people supported us. Many people wrote op-eds. Many people had joint statements supporting us, a patent-free vaccine for corona. And we are feeling happy that we are coming closer and closer to have a consensus on that, because WTO is the final decision making on that they need a consensus resolution. If everybody agrees, then they can do that. So we are trying to do that 100% thing. When finally it came for voting, we are counting numbers and praying. It couldn't come to the consensus. Very narrowly it failed. 10 countries abstained. 10 countries either abstained or voted against it. So which didn't generate the vaccine-free thing. As a result, you saw what happened. Vaccine was distributed in a very wrong way. 10 countries of the world took 80% of the production. Because they had the money, they took it, you know the whole story. So that was very frustrating, but we raised this issue, very fundamental issue. The medicine, healthcare should not be left to money makers. I'm not saying money makers are bad people. I'm saying that it shouldn't be left alone to them. But there are other versions of it. Another version I have been promoting for a long time and continue to do this in healthcare particularly. I said healthcare is an area where this version of business would be very appropriate, what I call social business. Business to solve problem rather than make money personally. People say, that's not a business. I said, it depends how you define business. So to me, it's a perfect business. So I said, there are two versions of business. With business, you maximize profit, which is a standard procedure, textbook thing, which was missing part, a business to solve problems. And it's an amazing tool for solving problems of the world, social business. It's a business, just like any other business, but the owners never take dividend out of it.
So that's what we have tried to do, so break down evidence-based health information in affordable speaking communities across the globe. And because there was such a big gap and people really felt the need, so that's why we've got about 12 million people following us for health information. And it's not entertainment, it's very bland. I'm just speaking to the camera, but people are tuning in to learn about what's happening to their bodies, what's high blood pressure, what's diabetes, what they can do, what exercise. So again, I think access to information is something, again, speak against the global south, wearables, innovation. So how do we actually make sure